My name is Dr. David Berkoff. I am a professor in the Department of Orthopedics at UNC Chapel Hill. I'm a sports medicine physician, meaning I'm not an orthopedic surgeon. I was first trained in emergency medicine and then went back and did a fellowship in primary care sports medicine. So my specialty is sports medicine from a non-operative perspective. Upwards of 15% of the population over 25 is going to have some sort of arthritic change, and those numbers probably greater than 30% as you get into that 60 plus age group. So it's everywhere. Lots of people are going to deal with it, and figuring out how to deal with it's really the key. There's an abundance of literature to support that moving will make your joints feel better, and although it seems counterintuitive, it's really the right answer. Activity is the solution to this problem. I heard it when I was a fellow. I don't remember who told me, but I say it every day now, is motion is lotion. So that day you're extra creaky and you don't want to get up and go, you get up and go, and 20 steps later you start to notice it's a little bit looser. I hear a lot of, I don't have time, I'm too busy. And so, I'll tell folks, then go for 2 minutes, go for 5 minutes. Because the reality is once you're up and moving, you'll often stay moving. And it's that impetus to get going or starting the engine is what I tell my patients. That's the hardest part of getting the motor going. And once you're going, if you only do 5 minutes, fine, you still did 5 minutes. And if you're going and all of a sudden you realize, oh, my knee feels better now, I'm going to go for 10 minutes, you've started to create that momentum. Surprisingly, particularly when you see somebody who's new to the diagnosis, who has been avoiding activity or avoiding exercise, it's very quick that folks realize, oh, my knee's not quite as sore. My hip actually feels a little bit looser. I'm able to move a little bit better. So the results can be fairly early and fairly quick. Not only helps with just some of the direct effects on arthritis, but it helps your mood. It helps your joints stay active. It helps you sleep better. So there's just a bunch of downstream effects to encouraging our patients to be active. If you've never exercised before, I'll tell a lot of folks you need to go get checked out by your regular doctor first. It's critical that you make sure you're safe to begin an exercise program. And a big part of what we do as sports medicine physicians versus a surgeon is try to manage the overall patient to getting people to be able to exercise and to be able to exercise regularly. I think it's important to understand that everyone will find the exercise that works for them. I think it's important to remember we're not all the same. We're not built the same. We don't have the same injuries. We don't have the same past experience with activity or ability to do things. I say find an activity that resonates with you. So you may not like running or jogging. It may be boring to you, but getting on a bike where you could read your iPad or watch Netflix, maybe that's better for you. Find something that resonates with you that'll keep your attention. Find one that doesn't hurt. So if you go to physical therapy and they're telling you need to get on the bike and spin and that makes you sore, but walking doesn't, then maybe that's not the right exercise for you. So find the one that works for your issues. And then find one that you can sustain for the long term. If it's some piece of equipment that only exists in your physical therapist's office or in a gym that you don't want to keep paying for, that's not going to work. So, to me, the right exercise, at least initially, is the exercise that you'll do, that you enjoy, and that starts to make your joints feel better. And as we talked about earlier, there's an abundance of literature to support that moving will make your joints feel better. And although it seems counterintuitive, it's really the right answer. Activity is the solution to this problem. I'm a big fan of start yesterday. Just, when you leave my office, go walk for 5 minutes. Right now, you're already in the plan. You're already going. So if you can get people to try to put aside all the excuses, the reasons, all the hurdles that we all create because it's extra work, and just do a little bit, with that background idea that I know this is going to help, I find that's a good way to get it going. And I just remind everybody, a little bit's better than nothing. And even if it's truly 5 minutes, 5 days a week, that's 25 minutes more than you had before. I'm a big fan just personally of having a goal. So I really tell people, whether it's somebody we're talking about, we need you to lose a little bit of weight, I'm going to shoot for 3 pounds until I see you at your next clinic visit, or you're going to walk a 5K. Just find something, or you're going to walk the entire lap of the mall. I mean, the goals can be very, very different for different people. But I think if you have that out there, that's going to help you, give you something to shoot for. And then, my last thing is always, you don't beat yourself up when you have those days or weeks that you weren't doing it. There is no accountability other than to yourself. So just get back out there and start moving again.